You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, who's a candidate for dental implants? According to my first guest, no more dentures. Get a fixed set of teeth in just a few appointments. With us, we have Arizona's oral surgeon, Dr. Buch. Dr. Buch, welcome to the program.
Thank you, Randy, for having me. It's great to be here and discuss a topic that I'm very passionate about, dental implants.
Okay, good. Now, before we get into today's topic, a lot of people know you because of the work you do. But for those that don't, tell us a little bit about your practice. Who's a typical patient? What are the procedures you do? And I guess you're an oral surgeon.
Yes, sir.
You do a lot of things.
Absolutely. So I'm an oral surgeon. I practice in the city of Glendale, Arizona. That's in the west portion of the Phoenix Valley. Valley of the Sun, great place to live. Have a great practice there. We help out a lot of folks to get rid of their dentures. So do a lot of procedures. Like many oral surgeons, I've been trained in the full scope, the full gamut of facial and oral surgical procedures.
So people that have like accidents?
Oh, absolutely. Trained in trauma. I've done quite a bit of trauma. I actually fixed a gentleman's broken jaw on Friday before I flew out here just this weekend. So also trained in orthognathic jaw surgery. That's where we take the upper and lower jaws and cut them, remove their attachment, actually the hard tissue attachment, change the bite, change the appearance of the face. So pretty big, interesting surgeries, a lot of fun. Trained in TMJ surgery, though I don't do that as part of my practice anymore. Also do some head and neck tumor and reconstruction. All benign, though, don't do any cancer surgery anymore. But a large portion of our practice is actually office-based, where we take out a lot of wisdom teeth on kids. Oh, yeah. Our patients range from children, small children, up to patients in their 90s and even older than that sometimes. So pretty wide, broad range of patients.
And the denture crowd, I guess the word is on the street. The denture wearers now can get a fixed set of teeth with just a few implants, I guess 4 or 5 implants.
Absolutely. There's no reason to have dentures any longer that slip and slide and move around. With 2 or 4 implants, we can have a set of dentures that snap in and snap out, give us much more stability than dentures, the traditional dentures that just sit on the soft tissue.
Now, as an oral surgeon, by the way, so let me get this straight. So the general dentist, they refer you most, that means you work with their current dentist.
Absolutely. Patients can keep their own dentists. We work with the general dentists. I've been trained in the restorative portion of dental implants, though I don't do that as part of my practice. The restorative end of it, Randy, is the teeth or the dentures that go on top of the dental implants that actually give people their smile back. So people come to me for teeth, not for dental implants. So I do the foundation work, any kind of grafting that we need to do to build up the tissue, hard and soft tissue, place the dental implants, and then I work with their current dentist in order to fix the final teeth in place and restore their smile.
So no more dentures. We started off the show. We're no more dentures. Do you think that's the future of dentistry?
Oh, absolutely.
The dentures as we know them today are going to be gone.
They're going to be obsolete, at least as we know them today. There's no reason to have those dentures, as I said, that slide all over the place and inhibit our patients from being able to eat and smile and talk and chew and kiss and date and all those things that they'd like to do. So
no more adhesive and things like that?
I don't know if you've ever seen the adhesive or known anyone that used the denture adhesive. It's a pretty thick paste. They generally put about a tablespoon of it on the inside of the dentures, top and bottom, and it actually glues those dentures into place. Tastes terrible.
They don't like
it. They don't like it at all. Difficult to remove. When I ask someone to remove their dentures for an examination, it's very hard to get that adhesive off of the tissue. So definitely something we'd like to avoid. With dental implants, we can avoid the denture adhesives, keep the implant retained dentures in place much better than they get with the adhesives alone.
It doesn't cost more to go to an oral surgeon, right?
It doesn't cost more to go to.
People are always asking me, who do I go to? I say, go to a specialist.
Well, that's a big misconception, Randy. Well, you know, I'm a bit biased. Of course I am. I'm an oral surgeon. But oral maxillofacial surgeons are the most highly trained dentists in the world. Okay. So we go through...
Nobody disputes that.
Nobody disputes that. Okay. So we do all of these big procedures. We're trained to, as I said, move the jaws around. Absolutely, big surgical procedures. So the minor procedures of placing dental implants and small bone grafts to help reconstruct areas of bone that have been lost, those are fairly typical minor procedures for an oral surgeon. They're a big deal for some other folks, but certainly for us, they're pretty minor. It doesn't cost
more to go to you.
It doesn't cost more.
Do they need a referral to go to the oral surgeon?
They don't necessarily need a referral to go to the oral surgeon. Absolutely they can. We work with the general dentists and get a lot of our referrals from the dentists as well as from physicians and hospitals in the area. Okay. But they can come directly to our office. If they have a dentist, we work with the dentists and make sure that from the very beginning of the plan to the end, that we're all involved. Now, if they don't have a general dentist, we'll certainly find one for them. We've got a lot of great dentists in the West Phoenix Valley and Glendale area that we work with who are very experienced in dental implant restorations.
People don't like going to the dentist. And
oh, certainly not.
Especially, I bet they don't like going to the oral surgeon.
Oh, they hate going to the oral surgeons.
That's when you're in trouble.
Absolutely, yes. They've been to a lot of dentists. Once these folks get to the point where they're losing their teeth, Randy, they've gone through a lot of procedures, failed root canals, the endo treatment, they call it, endodontic treatment of teeth. When they get to that point, they have abscesses, they've got swelling, they've got pain, they've got periodontal disease, big cavities, crowns that have fractured off. So these folks, they don't want any more pain. They want to stay away from the dentist,
so
and especially the oral surgeon.
Don't want to go to the dentist.
The denture wearers, after they lose those teeth that have been causing them all that pain for all of those years, they decide, I don't want anything to do with the dentist any longer. And interestingly enough, those are the folks, they don't go to the dentist anymore. So they have dentures that don't fit very well anymore. Consequently, they never really did fit very well, but patients get used to it. Humans are interesting because we have the ability to adapt and overcome and just do the best with what we've got. They don't know what they're missing, Randy. They don't want to come see me, but every year that they wear those dentures, they lose more and more bone. So early treatment or early intervention is important. If you look at a denture, and I'll pick one up here for you, Randy. We've got some props. The denture consists of plastic base, which is replaces the gum tissue in the bone that's lost, and the plastic denture teeth. And if you look at those, everywhere where there's that pink plastic is lost tissue, lost bone and lost gum tissue. And what happens over time is the bone atrophies. It basically melts away, and over time the denture becomes less and less stable. I always tell my patients that a denture sits on bone like a saddle does on a horse. Most of these folks don't have much horse left when they come to see me. There's just not a lot of bone left for those dentures to sit on. Well, the answer is to stabilize those dentures, and the way that we do that is we do it with dental implants. So the simple way, and let me show you this model here, Randy. I'm sure you've seen this before. The simple way is to put 2 titanium dental implants into the lower jaw and have a snap-in, snap-out denture that helps to secure it. So I'll
two implants right here.
2 implants
snap
right
in,
there,
snap
in, snap out. Now I'm going to let me have you take a look at that, Randy. Fits really nice and snug.
Okay. So is this accurate? I'm not exaggerating.
Oh, absolutely. You're not exaggerating.
My hand's probably too greasy.
Well, we even have patients as they get a little older have some arthritis where we've got too much retention. It sticks on there too much.
So it just snaps right out.
It snaps on, and the dentist can then change those little gaskets that allow this denture to come on and off a little bit easier. So I tell patients you turn it upside down, it doesn't come off. But on the inside, my hands are greasy too. On the inside, there's a couple of little gaskets snapped down over those dental implants.
Okay, so could you use their existing denture?
Oh, absolutely. Their existing denture, if it's the one that's been made fairly recently, can be retrofitted by the dentist to fit over the dental implants. That makes it even cheaper.
No more glue.
No more glue. No more glue. So
now what is it? And I'm going to get off topic for just a moment. But why is it, especially for the denturers, why is it what used to take you guys 6 months or 9 months now can happen in just a few visits?
There's been a lot of changes in the dental implant industry over the past decade or two. We've learned from experience, a lot of research, that it doesn't take that long for the implants to bond with the bone any longer. What we used to do is bury the implants under the tissue, close it up, wait 6 months before we put the tops on those implants that then connect to teeth or connect to the dentures. So what we've got now is we've got improved surface areas on these dental implants. They've actually gotten down to the micro and the nano structure of those dental implants and improved the bonding. The thread design has changed quite a bit, and our philosophy as surgeons has changed quite a bit. We know we can do things faster and better today than what we were able to, say, a decade ago. The other thing that's changed, Randy, is technology. It's actually really helped us with imaging. The new cone beam CT scanning has taken what used to be somewhat of a blind procedure and allows us to, in advance, determine the bone volume, the bone quality, that's how dense it is, the thickness of it, the position of nerves and sinuses and things like that, and we stay away from those areas. And we know.
Seems painful though.
Oh, it's not painful, Randy.
Do they complain about pain?
It's interesting that you should say that, because many of my patients, one of the big things that they say is, it's just not very uncomfortable. I met with a group of patients this past weekend who were implant patients that I had done previously, and universally they said, I thought it was going to be painful, and yet It didn't turn out that way. Let me give you a quick story. I had a patient this weekend I spoke with. His wife was in with him, and she said, I brought him in kicking and screaming. The reason why is because he'd had so many, as I said, failed dental procedures. She said the last straw was when I bumped into him one day and 4 teeth fell out on the table.
Wow.
And his periodontal disease was so bad, his breath was bad. She brought him in. He was very apprehensive. We sat down and talked about his options. And after the procedure, we put 4 implants in this gentleman, and he's got a snap-in, snap-out denture that's very
full
stable.
Arch of teeth.
Full arch of teeth and a full arch of upper teeth as well. And he said, it was a little uncomfortable afterwards, but very minimal. He said now, and the interesting thing is he tells me he can eat whatever he likes. Most people don't realize you've got a full set of teeth, Randy. You don't realize what it's like for patients with dentures. Let me just kind of walk you through a day in the life of a denture.
So there are no such thing as a happy denture wearer, according to you.
Well, as I said,
that are denture wearers. They never complain.
They don't know what they're missing, Randy. They absolutely have adapted and overcome, and they don't know what they're missing. Average denture wearer goes to bed at night, wakes up in the morning, finds their dentures in the covers somewhere. That's because they forgot to take them out and put them in a jar on this table next to them. So after they get over that, they put a tablespoonful of denture adhesive in their dentures, put them in their mouth. Breakfast is okay. They're going to have oatmeal or scrambled eggs or something soft, but they spend their whole day planning around what they can and can't eat. Social functions. They go to lunch and want to order soup with their friends instead of ordering a burger because they're worried their teeth are going to fall out in the middle of a lunch or a conversation. Have you ever been speaking with a denture wearer, Randy, and heard that clickety-clack sound? That is the dentures that move around when people are speaking. That goes back to the muscle attachment issue that we spoke about earlier. And what happens with these individuals is they're very embarrassed. So they'll cover their mouth. They'll avoid smiling. They'll avoid social situations where they...
Could you spot these people, by the way?
Oh, absolutely.
The denture wearers? I mean, could you spot them?
You can. Generally, they're not people that are living life as full as they'd like to because they're inhibited.
How do you spot them?
Well, usually...
Not in your office, but on the street.
On the street, well, you can hear them if those dentures click. What can happen if they don't wear their dentures is, as you lose teeth, you lose bone. And so what happens is the facial structure starts to sink in. And so you get those lips that curl in, and it makes folks look much older.
Are people ashamed of their dentures?
They're very ashamed of their dentures. They're ashamed of having the dentures, and they're ashamed of when those dentures move around. Studies have been done, Randy, that show that dentures underfunction. Your average set of dentures move an average of 1 centimeter. 1 centimeter is a little less than half of an inch. It tells me that teeth hit by accident when these folks are chewing, and they can't chew very much. So it's interesting, they did a study at McGill University up in Quebec. They took 254 patients to be exact, divided them in half. Half of them got new dentures. The other half of these patients got the 2 implant overdenture that I showed you.
So 250 denture wearers.
254 denture wearers.
Okay. Well, you came prepared today.
Absolutely. They followed them over 6 months. And what these folks at the University of McGill did is they did blood tests on these individuals. They found that the denture wearers, as opposed to the folks that had the implant overdentures, had higher body fat, had lower lean muscle mass.
Interesting.
They did blood tests and found that the folks that had the implant retained overdentures, because of the improved diet, had higher B12 levels, higher iron levels, lower cholesterol. So
they get more fiber. I guess
Absolutely.
They can chew things.
And that soft food, those soft foods are higher in calories, they're lower in fiber, they're generally not as nutritious.
Higher in sugar.
Higher in sugar, absolutely. Those refined sugars, carbohydrates broken down into sugars in your body. So what happened with the folks that had the implant overdentures, the snap in, snap out that I showed you, is they now can eat vegetables. The gentleman that I spoke about earlier can eat corn on the cob. He said he eats steaks. He actually told me that his diet has changed so much he's lost weight, had to buy new clothes, new pants. That's where the cost comes in.
The most expensive part is all the new clothes.
Is all the new clothes you have to buy. But it really does make a difference nutritionally for these folks. Now, the more support is, the more implants, the better the support we have for the denture. So this one was the 2 implant overdenture. We've got a 4 implant overdenture with a bar. Now, let me snap this off and show this to you, Randy. The reason why this is a little bit different and helps a little bit more with stability is all 4 of those implants are connected. The denture snaps down over top of it, and what some denture wearers don't like is the rubbing and the sore spots that they get. So with 4 implants, we can do either...
No rubbing and sore spots.
no rubbing and sore spots with this, because we have a not quite as long of an extension on these dentures. They call that the flange. So not nearly as long with these. So this snaps down just like the other set, very stable. I'll hand that to you while I grab my next model.
Now, one of the things I want to back up, because you said that people wait too long. I mean, but then on the phone we talked about that you could be 90 years old and get dental implants. I mean, could you lose too much bone?
You can lose too much bone to where we actually have to replace the bone.
But most people are candidates.
Most people are candidates. Actually, anyone.
A 90-year-old could do this.
A 90-year-old can do this.
What if they've been in dentures for 30 years?
Well, that's fine. I've done plenty of those individuals. Let me tell you another story. Had a 92-year-old patient came in with her daughter.
Why would a 90-year-old want to do this?
Well, and interesting you should ask that, because her daughter asked the same thing. And her daughter said, "Mom, why do you want to have dental implants?" And her answer, and she looked me straight in the eyes, and her answer was, "Because I want to eat whatever I choose to eat for as long as I'm on this earth." So we did 2 dental implants in her lower jaw with that snap-in, snap-out overdenture that we spoke about. And that was 5 years ago. And she, to this day, is still eating with those implants, and probably healthier.
Pain is not an issue.
Pain's not an issue.
The bone doesn't have feeling, is that why?
Well, there's very little feeling in the bone. Okay. So what happens is it's not nearly as uncomfortable as most people think.
But they don't fall out. It seems like on a 90-year-old. I mean, even you as a surgeon, don't you worry about that?
It takes a little longer for people to heal as they get older. That's just common knowledge. So with folks in their 80s and 90s, I give it a little bit longer for those implants to heal before we start to load them. What that means is we don't put the dentures in right away on folks that are in their 90s. Sometimes we do that and can do that in younger individuals, where you can get implants and get something that snaps in the same day or fixed.
What does that 92-year-old woman say when it's all done?
She said she should have done it earlier. She should have done it years ago, that she put up with these dentures moving around in her mouth for 25 years and wished she had done it earlier.
In Arizona, would you say there's tens of thousands of people with an upper or lower denture?
Absolutely.
So why aren't they doing it, though?
Well, they don't know their options, Randy. There's 30 million people in this country that have no teeth at all, and they wear dentures. And the vast majority of those have conventional dentures that don't fit very well. The conventional denture, Randy, covers the roof of the mouth. I don't know, you don't know what that's like, but we actually get some taste sensation through the tissue in the roof of the mouth. So what happens with these folks is they taste a little bit less their food. The texture is different, so they don't get to feel the texture of that food against the roof of their mouth. It also inhibits their speech a little bit, because, you know, when you push your tongue up against the backside of your teeth and the roof of your mouth, you articulate sounds a little bit differently. So those folks that have that palate coverage, that plastic that covers over the roof of their mouth, it's difficult for you and I to understand until you really start to talk to many of these individuals. Now, they say, "Oh, I'm doing fine with my dentures. I like my dentures." The reason why they like their dentures is it's preferable to those bad teeth, with those teeth that are painful over the years and they finally got them out. But we can actually replace a full arch of teeth and remove the palate, remove that coverage of the plastic over the palate, give people back.
How many implants for that?
Well, there are different options for that, Randy. I am a big fan. I'm a belt and suspenders conservative guy. I like to do 6 implants on the top minimum. There are some particular folks that will do 4. There's a technique out there called all on 4.
You do that?
Absolutely, and we can discuss that. All on 4, and I'll tell you what's good and what's bad about it, Randy.
You like this, by the way.
Well, yes, absolutely.
Why are you so passionate about this? I mean, of all areas of dentistry, oral surgery, I know you're a medical doctor as well, is this the happiest group of patients?
It's the one group.
You take a denture wear and you convert them?
It certainly is. It's one of the groups of patients that I can make the most difference in their life with the least amount of surgery and really change their, it's truly life-changing. And the diet, the speech, these folks can go out and be confident and smile and engage in social activities that they didn't do for years and years. So removing that coverage of the palate, taking away that plastic denture on the top, certainly that's the area they put the adhesive on, but they don't need the adhesive anymore. So the denture then slides over top of either individual implants, a bar, or even a fixed set of teeth, Randy, that can be screwed in.
You have an animation.
Absolutely. This is the all-on-4 technique. Okay. Let's watch the innovation.
We're out of time, but it kind of shows the procedure. What are we looking at before we look at it?
We're looking at 4 implants placed in the lower jaw with fixed teeth screwed down on top in the lower jaw.
This is that all-on-4 procedure?
That's that all-on-4 procedure.
But the same could be said for 6 or 8?
Same can be said for 6 or 8. It's a technique. All-on-4 to me is a technique. In the lower jaw, it works great. What's good about it is you can have a fixed set of teeth on 4 implants.
Okay, Let's take a look at this.
Absolutely.
For a second. Okay, we're going to the clip.
So the implants are placed into the lower jawbone. There's little devices that are placed over top that are abutments, and then the fixed teeth are screwed down into place. So the patient cannot remove those teeth. The dentist can remove them. Now, it works great when it works great, and for many candidates, it's a great option.
Is it that simple? With the way we're looking at this?
It is pretty much that simple with a bit of lab preparation in advance, so absolutely.
But I know you want to mention something before we went to that clip, and I interrupted you. So
certainly, I wanted to make sure that you understand that the all-on-4 technique is not something that I like in the upper jaw. The reason for that is the bone is softer in the upper jaw than in the lower jaw.
I mean, 4 implants for the upper?
4 implants for the upper is not something I recommend. I'm an all-on-6 fan in the upper jaw rather than all-on-4. It does help to support the dentures much better. Will allow us with bigger individuals to function on those implants for an extended period of time. We'd like to consider these permanent tooth replacement options or support for the dentures. So.
Now, because there's a lot of advertising, how are you different than some of these kind of chain companies that are doing dental implants? Or are you different?
We're very different, and because I don't work for a big chain company, I have my own practice. Some of these centers, Randy, they have a different philosophy than I do. I want to tailor the procedure to the patient to make sure we meet their needs and make sure that the implants and the teeth last a lifetime for them. Okay. So we can, if we need to, place 6 implants rather than 4. We've got that ability because we're not selling a kind of a boxed set, if you will, with the treatment. Absolutely. So you ask about cost. Cost is not something that where it makes it more expensive to see a specialist as far as an oral surgeon than a general dentist. There's many general dentists out there with great credentials and experience in dental implantology. But as I mentioned before, with the training that oral and maxillofacial surgeons have and that I have, these are pretty routine procedures for us.
If I knew what you know, would you say, I mean, could you say, you know, everybody needs to go to an oral surgeon if they're going to do dental implants?
Oh, that's my bias.
Is that your, I mean, do you believe that?
That's my bias. We've got anesthesia training that allows us to take patients that are very fearful, either sedate them or drift them completely off to sleep with a general anesthetic technique, and it's much more comfortable for patients, not because of the pain involved, but the anxiety behind the procedure.
So no more dentures.
No more dentures.
Photos. We may have time for like one photo.
Absolutely.
What am I looking at?
Well, what I want to show you is a gentleman who came to see me. He was a businessman, does a lot of traveling, a lot of lunches, business dinners, things like that, and he had a full upper denture. And he didn't like it for all the reasons we discussed before. Loose, pops in and out, unable to speak well with it, gets food caught up underneath it when he eats. So he asked me what his options were, and we talked about the 2 and 4 implant snap in, snap out for the lower, and for the upper, obviously, we talked about more implants for that. We talked about the fixed set of teeth. He actually chose to do 6 implants on the top with a set of snap in, snap out. And the reason he did that was because he wanted to be able to take them out, to be able to clean underneath them, not have to go back to the dentist to have those removed all the time. So here's a picture of him smiling. Just a great picture, happy guy. Now he can go to his business meetings. He can eat whatever he likes to eat.
They look natural.
Absolutely, they look natural. It's a cosmetic look. Absolutely fills his face out more than a facelift with a plastic surgeon would.
So what's the first move? Okay, so you have a denture, and by the way, we haven't mentioned, I mean, people missing 1 tooth in the front, kids that are born without teeth. I mean, these are all things you do.
Absolutely.
Because we spend a lot of time talking about denture wears, but you do all of that.
Do the full gamut of dental implants. Anyone that's missing a tooth is actually a candidate for a dental implant.
What if your gums are too bad? Bad gums.
Bad gums. Well, we need to treat the gum disease, and we certainly do that by either treating the gum disease with the existing teeth or removing the bad teeth. So gum disease patients are not excluded from the implant treatment planning. The first step is to come in, sit down, and have a consultation. We'll assess what your needs are, where you want to go, what kind of teeth you want, whether it's fixed or removable. Assess the bone, assess the gum tissue. Absolutely meet with them, go over their medical history, talk about the medicines that they're on, the medical problems that they have. Being a medical doctor, Randy, going through medical school, I'm very comfortable treating individuals with a lot of different kinds of medical problems. So I have some pretty complicated patients with medical histories that are big.
Osteoporosis,
absolutely, heart disease, patients that have actually gone through kidney transplants, all those types of things. Certainly, I'm very comfortable in treating those individuals in conjunction or with a consultation with their primary care medical doctor. So.
And I appreciate the fact that you came on the show. But when you come over here, I mean, when your main message, like when you come over here for this interview, what do you want people to know? What's your final message?
Well, I want people to know that they don't have to live with the situation they currently are in. They don't have to be embarrassed of those ill-fitting dentures. We can change their lives with a few appointments, giving them a fixed set of teeth, whether it's with dentures or with implant crowns, and work around the teeth that they have.
Insurance doesn't cover this for the most part.
Oh, well, insurance has actually gotten much better. Oftentimes, they will cover a portion of it. So we maximize the patient's dental insurance, either on our side or on the restorative dental side. We're able to take those individuals and maximize their yearly insurance. Medicaid does not cover this, absolutely.
But you have financing available.
We have financing available. Most of my patients say it's the best investment in their health they've ever made. So I would say do something for yourself to those patients. Do something that's going to change your life dramatically. And that's my message. I just hope I have time to go through this really quickly. I wanted to make sure that everyone knows with as few as 4 implants on the lower jaw or 6 on the upper jaw, we can replace a missing set of teeth with a fixed set of teeth.
A full arch of teeth.
A full arch of teeth, right?
Now I guess they come in different, because you showed me that picture there. You could have acrylic, you could have all porcelain, like individual teeth if you want.
Certainly, a lot of options, individual teeth.
How do they take care of them, by the way?
Those teeth are taken care of the same way that you would take care of your natural teeth. If they're fixed, patients can brush those teeth. I encourage the denture wearers that have the snap-on, snap-off dentures to brush around those dental implants, to take their dentures out and clean underneath them to make sure that they keep healthy gum tissue.
So things like teeth in the same day, where they can go in missing a tooth or teeth, and walk out not only with the implant, but teeth on top.
It's certainly a possibility. Come in and get evaluated. I'll take a look, assess the conditions and the situation, and give you your options.
I want to thank you for coming on the show. Good
Thanks
stuff.
for having me.
Great
Pleasure
info.
to be here.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website. If you want to direct a friend to it or tuned in late, go to our website at wellnesshour.com and put in Dr. Buch. That's, I think, an easy one to spell, B-U-C-H. And you'll find him there. Also, for those of you on Twitter and would like to say something nice about Dr. Buch, you can put hashtag The Wellness Hour. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.